wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to the program today. I have with me Jason Gourlas, who's a physician's assistant here at the Hotze Health and Wellness Center. And I've asked Jason to join us today and discuss a topic that really doesn't get discussed much, but people always complain about it one way or another, and that's the whole idea of sleep and how important sleep is for our health. So, Jason, tell us about this. Tell us about sleep and why is sleep important to our health? What happens when people sleep?
Well, it's interesting, sleep is probably the most important thing when it comes to your health. And there's a lot of things that go on during sleep that people sort of take for granted. You recharge, your tissues are repaired. So if you have injuries, that happens predominantly when you sleep. Certain hormones are secreted when you're sleeping, like growth hormone, which is very important as you age for lean muscle mass and things like that. Your brain actually detoxifies. Your brain shrinks a little bit, and there's something called the lymphatic system that is analogous to the lymphatic system in the body, and that's how we get rid of toxins like beta amyloid plaque and tau and things like that are associated with Alzheimer's disease. So that's incredibly important. And we metabolize emotion, consolidate memories when we sleep. So those are some of the minor points of sleep.
Right. And so is there any studies on what amount of sleep is adequate and what's an optimal amount of sleep? Have they done any studies on that? What is your take on that?
There have been studies, yes. And as we are younger, we need much more sleep than when we get older, but optimal sleep time is probably 7 to 9 hours. You may need a little less as you are as a senior person, maybe 8 hours, but there's 4 stages.
I thought you meant like a senior in college.
No.
They need a
little bit older person. And so they've actually done studies, there's 4 stages of sleep, and optimally you would cycle through those.
Well, let's talk
stages.
about those 4 stages.
So there's 3 non-REM stages of sleep, and then there's 1 REM or rapid eye movement stage of sleep. And it's the deepest part of sleep, the 3rd non-REM stage of sleep, where that lymphatic system is most active. So it's incredibly important to get to that deeper layers of sleep. And that becomes a problem with folks that are ingesting caffeine too late in the day, drinking alcohol too late in the day, have obstructive sleep apnea, which is a common problem nowadays. And so optimally, we want to get to bed somewhere around 10 or 11 o'clock at night, but that's obviously contingent upon the time you need to wake in the morning.
That's right. Some of us are night owls. Some, I like to say, everybody says, early bird gets the worm. And I say, I go to bed late enough, I take the worm before I go to bed. While you guys are still sleeping, I'm eating that worm.
Right.
So, so sleep's important. Now, let's talk a little bit about sleep apnea. And what are the signs of sleep apnea, and how can what kind of adverse effects does that have on a person's health? And what studies can be done to determine whether a person is sleep apneic? And then what can be done for it?
Well, a lot of times it's daytime somnolence. So if you feel sleepy in the daytime, that's a good bet that you're not getting enough sleep at night. So a good indicator is your bedfellow. So your spouse, if they're not getting as much sleep as they would like because you're snoring. And sometimes you might actually find that they'll tell you that you stop breathing at night. Other clues could be that you grind your teeth. Your dentist tells you grind your teeth. You're waking snoring and waking yourself up snoring, waking with a headache, a dry mouth, or a sore throat. Sometimes it's found by your cardiologist and says that your heart is enlarged and there's no other reason for that. And when you have obstructive sleep apnea, your oxygen levels drop, and that constricts the blood vessels from your heart to your lungs, and that can put an extra strain on your heart, making the right side of your heart bigger.
And so there's some studies that can be done on that. What do we do here at the center?
We actually use a home sleep study, and that's something that could be ordered online actually by the guest. And it's a very sophisticated device. It's almost as good as the device that you can get in the hospital or in a sleep center. It's almost sort of like an oversized wristwatch. It fits on your wrist. There's a probe that goes to your finger that measures your oxygen saturation. There's a probe that goes to your chest, because there's a couple different types of sleep apnea. There's central sleep apnea, and then there's obstructive sleep apnea. And so we want to make sure that we can discern between those two things.
And so if someone has sleep apnea, now that can be caused, of course, by a person being overweight.
Definitely.
That's a very common cause of sleep apnea is weight. So obviously get yourself down to an ideal body weight, and that'll help you so you don't have sleep apnea. And when you have sleep apnea, that means you're apneic, you're not breathing. And when you're not breathing, you're not getting oxygen in your body. And you don't get oxygen to your brain, and this adversely affects all the organs in your body. If you have a series of sleep apneic effects during the night, it's obviously going to adversely affect the organs of your body when they don't get enough oxygen. So what are some of besides getting down on ideal body weight, I've also seen studies where men who have low levels of testosterone tend to have sleep apnea. So that's another thing you could do is check your testosterone levels. And men, as you get older, your testosterone levels are going to inevitably decline. And testosterone can be very helpful in numerous different aspects of health, not only maybe really sleep apnea, because as you get your testosterone, it boosts your metabolism. You boost your metabolism, your thyroid works better. And you've got more, you have more energy. And so you're not sluggish. You're not a slug just laying in bed. Helps you get your weight down to an ideal body weight. So I'd highly recommend looking at testosterone as a potential in treatment. And then what are some of the mechanical things you can use for sleep apnea?
Well, interestingly, there's some physical therapy that you can do. It's called oral myofunctional therapy, which tightens the airways in your mouth during the day and keeps them tight at night. There's some dental appliances that can bring your jaw forward to keep your tongue from falling into your airway. There's a device that we have here called ExciteOS, which is also sort of a trainer for the tongue. It's electrical stimulation to the tongue during the day so that it keeps the tone in the airway at night. There's some laser procedures that can tighten the airway, so that is not an issue. There's tongue stabilizing devices. There's a lot of other things beyond CPAP, which is that mask that blows into your face all night long, which some people can't tolerate. And I did want to just add, it's not just overweight people that have obstructive sleep apnea. There are plenty of thin folks in the world, and there's probably a genetic predisposition to obstructive sleep apnea. So if you have those signs and symptoms, but you're of a normal body habitus, then I would not just discount that.
Yeah. Good point. So let's talk about people that don't have sleep apnea, but they're having problem with anxiety. Like you said, they drank too much coffee after dinner, or drank a cup of coffee, and they have caffeine in their system, or had a Coca-Cola or something, and so they got caffeine in their system, which is a stimulant, and some people have a real hard time with coffee. Mm-hmm. I don't. I can drink coffee anytime, day or night, and doesn't seem to bother me. I can go to bed and fall asleep. But in some people, it wears them up. They can't sleep at all.
Right. And I'd actually caution people, even some folks that are fast metabolizers of caffeine, like you seem to be, and I am as well. I can drink a cup of coffee and go to bed, but that probably does affect your sleep architecture, which is the layers of sleep that you go through. So just because you can fall asleep doesn't mean that you're going to get the restorative sleep that you need.
That's exactly right. So what about any natural preparations would you recommend for people to take if they're having problem falling asleep or their minds are racing at night? What do you recommend?
Well, first I'd even start with just the beginning of your day. The most natural thing that you can do is get outside in the daytime, get bright light in your eyes, actually touch the earth with your bare feet, something called earthing, and it's been found to set your circadian rhythm. So the circadian rhythm is the natural day-night cycles. Right. And so in lieu of even supplements or medications, just starting out your day, preparing for sleep at the beginning of the day is important. And then as the day progresses, the sun goes down, cortisol starts high at the beginning of the day. And as the sun goes down, cortisol levels drop, melatonin levels come up. And so in order to not suppress the production of melatonin, I would recommend dimming the lights in your house, reducing, stimulating physical activities. Some people even go so far as to changing the light bulbs in their house to amber lights, blue lights, or even lighting some candles, because those frequencies of light don't inhibit the production of melatonin. But if you're doing all those things and you're still struggling with sleep, you can supplement with melatonin. As we get older, our bodies naturally make less melatonin, for sure. And the other things are calming substances like L-theanine, which can be very helpful for turning off the brain at night, which is an amino acid that comes from green tea. Valerian root, inositol, which is a calming B vitamin, tryptophan or 5-HTP, which are actually the precursors of serotonin, and then melatonin can be helpful. And we have a product here called Sleep Formula that contains all those things in one convenient thing. The other thing that can be potentially helpful, and I found helpful in my practice, is folks whose circadian rhythms are really off and their cortisol levels are high at night, is something called Cortisol Manager. And that's something we have here as well that contains natural products that actually suppress the production of cortisol. And that tends to be an issue. Cortisol dysregulation tends to be an issue for people who wake early in the morning, typically sometime between 2 and 4 o'clock in the morning. And if that's an issue for you, then it's a good bet that you have some cortisol dysregulation.
So sleep's important for regeneration and rejuvenation of your body, all the organs in your body, your brain cells and all that. And there are different levels of sleep that we've talked about. Some people have problems with sleep because they have sleep apnea, and that can be due from overweight. You may not be overweight, may still have sleep apnea. And that's where you as you fall asleep, either because of mechanical problems in your throat, your tongue, or central problems in the brain, that you don't properly sleep well, and you have a time during your sleep when you're not breathing at all. And that's when the snoring happens, or somebody kind of awakes from a sleep with a loud grunt or a groan, trying to gasping for air. So I know, been on hunting trips when all the guys are in bunk beds, and you hear the guys, that are having a problem with sleep apnea. I don't know.
And everybody has a problem.
Yeah, and I don't know if they drank too much the night before or what. But anyway, they were having some problems with their sleep. So what you want to do, and we've talked about it. How do you get you mentioned we can get the room prepared. What about having? You can change the lighting in your room. Mm-hmm. Dim your lights earlier at night. Try to stay away from alcohol as you move towards, later in the evening. Maybe you won't have a glass of wine at dinner or something, or you go out. But late at night, drinking will adversely affect your sleep patterns, as will caffeine, obviously. So you want to cut back on that. And then if you're having problems with stress and maybe some sleep problems, you can consider taking, especially as you mature, you can consider taking melatonin. You could take inositol. You could take L-theanine, 5-HTP, and some other preparations that can help you with your sleep, and the other medication that would help reduce cortisol levels. Remember, when we talk about the diurnal variation, when we wake up in the morning and the sun comes up, our human body is made to produce high levels of cortisol, get us up and going. And then as night comes and the sun goes down, our cortisol levels fall, and we feel tired and we go to sleep. I noticed this in my dog. I've got a retriever, a silver Labrador retriever. And that boy, he's up in the morning ready to go. But when that sun goes down, he wants to crawl in. He'll roll over and just start snoring right there. And he sleeps a lot during the day anyway. But when that sun goes down, he doesn't want any part of being up. He wants to go back, crawl into his kennel or sleep in our bedroom and go sound asleep. And that's the diurnal variation. I'm sure his body's experience. It's, animals of his nature that get up in the morning, they're ready to go, and then when that sun goes down, they're ready to go to sleep. And that's the way it probably should be. There's a reason we have
made that way.
Yeah. Well, thanks for joining us today, Jason. Jason's a physician's assistant and a provider here at the Hotze Health and Wellness Center. We believe that every one of you needs to be on a path of health and wellness naturally, so as you mature, you have energy, vitality, and enthusiasm for life. So if you'd like to come in and help us or allow us to partner with you to get you on that path of health and wellness, we'd be pleased to do that. Just give us a call to the number on the line, and one of our new guest consultants would be glad to visit with you. Thanks again for joining us today.
Thank you.
At Physicians Preference Pharmacy, we specialize in compounding bioidentical hormones, which means that all of our hormone medications are made right here on site in our compounding labs. The term bioidentical means that the hormones in the products that you're taking, whether that's in a capsule, a tablet, or a cream form, are chemically identical to those which your body produces. So your body responds the same way it would to its own hormones. This is important because hormones work in the body as a lock and key system. Just like your front door, only one shape of a key will fit the way it should to unlock that door. And the same goes for how hormones work within your body. For a medication to be the most effective, with the least number of side effects, we must give your body something that it recognizes as its own. And this is why we choose bioidentical.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.